Hello, and welcome to our webinar on tips for reducing emotional distress in patients with dementia, brought to you by the California Partnership to Improve Dementia Care. I am Dr. Jennifer Bersall, a licensed clinical psychologist with CHE Behavioral Health Services, and also today we have Dr. Julie Futrell, also a licensed clinical psychologist and with CHE. So to begin, the first thing we want to briefly do is just discuss some of the increased potential stressors that our residents with dementia may be experiencing because of the COVID-19 pandemic that certainly can impact their emotional well-being. And when we say emotional distress, we mean things like increased anxiety, increased depression, possibly increased agitation. And so what are some of these triggers? Well, certainly changes in their routines. That can be very distressing and more difficult for someone who has dementia and may find that they get more easily disoriented or confused or have memory issues. And so these changes include changes in their room, potentially their units, certainly the staff, right? The staff that are caring for them. If they are put on a different unit with different providers or have providers that may not be coming in or having different shifts, that can be very difficult. They are experiencing a reduction in their activities, their formal recreations, the space that they're participating in those activities, right? So where they can go, where they can spend time, certainly a reduction in socialization, spending time with other residents. And a big one is not being allowed to have their family or friends visit. So that can be particularly distressing. Certainly they may be experiencing losses. They may have residents at their facility who have passed away, staff or their caregivers, loved ones from out in the community. Because of all the stress, our residents with dementia are not the only ones experiencing the emotional stress of COVID. We are as well as the caregivers in long-term care. And so that stress can be felt on the unit from staff, how we talk to each other. And that can certainly impact our residents as they feel that increased stress or that change in emotional atmosphere. And finally, wearing PPE, right? So now we have to cover a significant part of our face. We're less recognizable. That can be quite scary or frightening to our residents. And taking all of these things combined, it's no wonder that we may see increased anxiety, depression, agitation, and also perhaps some challenging behavioral reactions because of that. And this is even more important for us to consider for our residents with dementia because of their thinking deficits related to the dementia process. They already have a harder time with emotional regulation. So if they are having trouble remembering, why can't their family members visit, right? What are these changes about? If they're more disoriented because of a change in their room or unit. Executive functioning, that's that front part of our brain and our frontal lobe. That's really our problem solving, our reasoning, our decision making. If that's impaired, it's going to be harder to understand difficult situations or changes or tap into coping skills. So all of these things combined already make it more difficult for our residents, especially when they get into the more moderate to severe stages of dementia, to manage stress. So now we have this combination of potentially poor coping abilities for our residents with dementia on top of many more stressors that they need to cope with. So what do we do about that as their caregivers? Well, the first thing we need to do is recognize when they are experiencing emotional distress. This is especially important in individuals with more severe dementia, especially if they have trouble communicating, or they may have, poor insight, not really understand that they're experiencing more anxiety or depression or why that's occurring or how to communicate that to us. So as their caregivers, I always say we need to be their healthy brains. We need to be their memory. We need to be their executive functioning. We need to be their planning and problem solvers and help them. And so the first step is recognizing when they might be experiencing emotional distress. And so there are many indicators, and another word for that is cue or clues that they are experiencing anxiety or depression or some other difficult emotion. And so emotional indicators are things like crying, being more tearful, perhaps the opposite, just seeming like they have a flat affect all of a sudden, there's more numbing. Verbal indicators could be more yelling, cursing, any kind of perseverative noises. Behavioral indicators are things like, unfortunately, more physical aggression or agitated, striking out, Certainly pacing, restlessness, maybe more wandering, which can certainly be problematic during the pandemic with infection control. Somatic indicators are body indicators. So some may express things like having more headaches or muscle tension or stomach upset. Cognitive indicators, of course, with dementia, we would expect there to be some cognitive decline, but this would be more an unexpected change. So more confusion, more forgetfulness or concentration difficulties. And then finally, changes in their sleep and appetite. And of course, we recognize that these different changes could be from multiple, reasons. It might be something medical going on, something that's not just emotional, but all of these can absolutely indicate more emotional distress like anxiety and depression. And especially during the time with the COVID-19 pandemic, when we know that our residents are faced with significant stressors, we really want to be aware of whether, they might be experiencing emotional distress. Because as their care providers, we certainly want to take care of their well-being as a whole person and make sure we're caring for their emotional health as well as their physical health. The next thing we want to do is consider interventions, non-pharmacological interventions that we can use to help our residents feel better, to really address and help them cope with the different triggers that may make them feel more anxious or depressed. And so what we want to do is really identify the root cause. And you may have heard this, conducting a root cause analysis, really trying to consider what is the reason that's causing them to feel anxious or depressed. And what I can tell you as a psychologist is there's always a reason. And as a care provider, it's our job to identify that reason or trigger so we can try to prevent it from happening or address it in some way and develop interventions that can help the resident cope, especially for things during the COVID-19 pandemic that we may not have control over, right? We cannot prevent or fix that family members can't come to visit in person. So that's a situation where we'd really want to find some way to help that person cope. But in terms of trying to identify the trigger, we go about doing this by really thinking, what are the patterns? What are we noticing? What happens right before the person starts to show us those indicators I said earlier of anxiety, right? Who was there? What was happening? What was not happening? So we really want to look for those patterns and see if there's any need that we can meet. When we think about the COVID-19 pandemic, these are some questions, some additional questions to your great person-centered care plan and root cause analyses that you already do that we might want to start asking ourselves as their care providers. One is, are they not able to understand, what is happening? So if they have significant memory deficits, are they not able to understand or remember our explanations for why their daughter can't visit in person, right? So what can we do to kind of help that person acclimate and cope? Could they be having too much or too little activity? Probably the issue is going to be too little during this time, but are they bored? Do we need to really focus for this patient on really coming up with more consistent activities that we can support them with independently? Are they having a really hard time adapting because of some change in their routine, in their care provider? Have they been around people who they're not familiar with? Again, if they have a new roommate or a new care provider, and what can we do to really help them cope and feel more comfortable? Are they frightened or confused with our PPE? Do we need to make a special effort to really make sure they understand who we are and what's going on and be very sensitive? Or again, are they responding to your emotions, right? Are you presenting as stressed or upset, or maybe saying things that you're not aware of when you're providing care? And they're mirroring that back, which Dr. Futrell is going to talk a little bit more about. So in terms of these triggers, what are some things that we want to consider specific again to the COVID outbreak? The first thing we want to recommend, and by the way, this has been recommended by many experts, not just for residents with dementia, but really anybody at large around the globe at this time, is to limit COVID-19 news. In the nursing home, we are used to leaving the televisions on all day, leaving the news on. And yes, I understand for many of our residents that news is one of their pleasant events. It's one of their activities. And certainly this does not mean, being uninformed and not allowing our residents to watch the news, but it does mean limiting the news and being a little bit more conscientious about how much that our residents are engaging in, because it's certainly showing in the general public to really be increasing anxiety and distress levels. If we can avoid relocating our patients with dementia, so if we have to do some shifting in our facilities, creating new units, if we're able to, let's try to move the residents that don't have cognitive impairment, don't have memory issues. They're going to be more aware of the situation, more understanding, and a little bit more adaptable. Certainly that may not be possible depending on the situation in our facility, but that's something to consider. Avoid conversing with colleagues about your own stressors as the care providers in front of patients. And this includes patients with dementia. Don't think that they're not paying attention, that they're not aware. If they hear staff saying like, oh my gosh, someone called off, we're understaffed, how are we gonna get everything done today? I'm feeling really stressed. They're absolutely gonna internalize that stress themselves. And so it is okay to feel stressed. It's stressed and seek help from your colleagues and to communicate, but we want to be mindful about where we do that and where we have those conversations. And similarly, we want to, be aware of our tone, how loud we're speaking, not arguing in public, raising our voices, and kind of adding to the general atmosphere of distress. We really want to do our best to model a calm, serene, supportive environment for our residents. We want to make sure, because we have to wear PPE, that you introduce yourself every single time you walk up to a resident. Don't assume they know who you are, that they've gotten used to your PPE, that they know your voice, that you are their CNA and you work with them every day. So wouldn't they just assume it's you? That can be very distressing. So we always want to make sure we are proactively introducing ourselves, communicating who we are and what we're doing, right? The care we're going to be provided. And actually, I've seen a lot of people recommend, which I think is really neat. They've taken pictures, really big pictures, laminated it so it's plastic. It's very easy to clean, and kind of wearing that in addition to the name tag so people can see the familiar face. And if you're able to, since there's been such a change in routine and activities, as best you can, try to kind of reinvent a new simple routine that your residents can get used to that can be very calming and help reduce anxiety. So these are some, unique pointers specific to the COVID-19 pandemic. And with that, I'm going to pass it over to Dr. Futrell, who's going to continue on with some additional non-pharmacological interventions we can do to help calm our residents and help them manage, the different emotional distress they may be experiencing because of COVID-19.
Thank you, Dr. Birdsall. All of that, everything that's been presented is so important, but I think if we think about what is sort of most important when we approach a dementia patient who is either acting out or frustrated or upset, it's the way we approach them, and that's that mirroring of emotions that Dr. Birdsall mentioned. When we're calm and we're compassionate, we typically can see that mirrored in a dementia patient. If we think about it from the perspective that that front part of the brain that Dr. Birdsall mentioned is not functioning anymore, well, then they're responding sort of to what our feelings are, and they pick those things up very quickly. So check your own reactions whenever you're responding to a dementia patient. Keep your voice level. Definitely don't argue with the person. Try to be very calm, mirror calm emotions in your face as well, because they're going to mirror what they pick up about you. So the more sensitive that we can be, both to their fears and to the fact that they're scared and lost, that empathy that we can really sort of express in our own emotions to them. If we can listen to them calmly, even when they're repeating themselves, just allow them to tell you their concerns, reassure them, let them know you're safe. Maybe repeat your name over and over again, or that picture that Dr. Birdsall suggested, point to that. Really try to make them feel safe, because that's what's happening, is they're feeling very unsafe right now with their routines thrown off. So the more that we can validate and the calm and the compassion that we can bring, the more they're going to sort of calm down themselves, and they'll feel safer as well. So when we communicate, this is the other big part of it. We want to be super clear. Keep it very simple. Don't go on and on, because that tends to confuse people that have dementia. If you can use small chunks of information at a time, give them 2 to 3 choices whenever you're sort of helping them think about pleasant activities. Basically, don't overwhelm them. So short and sweet, compassion, kind, calm. And then finally, we have to reorient sometimes. And again, I think patience is this word that we're really looking at. When we have a dementia patient that's anxious and we're trying to sort of redirect them to a different thing, just remember that they can be repetitive and persistent and perseverating on something. And that's just their anxiety speaking. So answer their question repeatedly. Try not to get irritated with them. Try to redirect them if you can. Use memory cues. Visual boards are great. Whiteboards, something that will sort of take their attention to something else. And the big one is avoid saying, "Don't you remember?" Because that can really escalate agitation and depression because they don't remember. And you've just reminded them that they don't remember. So that can really increase emotional distress as well. And we actually have a video in this series on pleasant events and redirection. So I'll just sort of tell you here, we want to always try to be giving them pleasant things to do. So watch that video for more things, but some ideas are music to listen to, technology if your facility has it, help them FaceTime with their family, arts and crafts, just anything to sort of, give them something else to focus on other than the disorientation of the environment around them. And finally, you have a behavioral health specialist in your skilled nursing facility, use them. Refer to the psychologist if you need some help. Sometimes staff needs help, so always feel free to really sort of pull in your psychologist if you're really in need of some help and at your wit's end. We're here to help you. And I think we're back over to Dr. Birdsall now.
Yes, thank you, Dr. Futrell. We're actually almost done with the in-service, but one thing I did want to offer is a very brief grounding technique to our providers watching today that they can do with their residents who have dementia if they're seeming more escalated. So, grounding techniques are really just something that we use to help someone reshift, right? Refocus, kind of get them, to take a mental break from whatever it is that's causing them to feel, emotionally upset, whether it's very anxious, very angry, very agitated, so that we can, I like to think about it, just kind of lower their emotional thermometer, get them to kind of cool off a little bit. That doesn't mean that we're done at that point because something triggered them, right? I was talking about earlier that we really want to understand what caused that resident to feel upset, and we still want to do our root cause analysis and our person-centered care planning to address those triggers, but this can be really helpful in the moment to help them calm and feel better. And so there's two grounding techniques that I like to use with residents with dementia. And the reason I like these is because they're really simple, they're concrete, they're easy to follow. And so we can use them as long as someone's not, in the very severe range of dementia, as long as they can communicate and have good understanding, we can use this with those residents. And so the first one is to just ask the patient to describe something in the environment. And because when we actually focus on something outside of ourselves and we do something like naming or describing something, and here's my cat today, this would be a really great intervention if we can get a cat everywhere, right? Not so much an infection control situation, but this is another good intervention, pet therapy. But if we have them name something, they're just kind of taking their mind away for a second, and that really de-escalates. So Julie, can you be my patient for a second?
Absolutely. And my cat's sitting right here too, just to let you know.
Good. Okay. See, so this is our COVID support for our own emotions, right? Our cats. So Julie, I know that you're feeling really, really upset right now, and we're gonna really figure this out together. And I'm gonna work to help you. Let's just do something to just quickly take your mind off it, just to kind of help you kind of, feel a little bit better. And I want to distract you for a moment. Can you look out your window for a second? Just, tell me everything you see out there. Just start describing that for me.
A tree with the wind blowing the leaves. And there's a car driving by right now. And my neighbor sitting out on the front porch reading a book. And my cat laying here.
We'll count that even though your cat's inside. Okay. And so literally that's just what you do. You ask the person to just start naming what they see. If they don't have a window, if it's person in the A bed, right? You can say, John, just take a look at your dresser. What do you have on there? Describe that to me. Really, it can be anything. Tell me what, just start naming things that are blue in the room, but you're really taking something in the environment and asking them to redirect their energy. And again, the goal of this is just to help them kind of let out that breath and just feel a little bit less intense in those emotions. The other thing, so that's very concrete, and you'll know your patients and you know their personality, and that will work for some residents. This other one is kind of like an imagery exercise where you're going to use your imagination. And so if you know that you have a more creative or artistic resident, they may actually like this one as well. And so here what we're going to have them do is imagine anything that's bothering them, kind of moving it and balling it right up into their fist and letting it go. So Julie's going to be my patient again. Julie, oh gosh, you know, I hear you and I can see you're really upset. You know, I'm going to work on that. As soon as I walk out of this room, I'm going to try to, you know, talk to the nurse and figure that out for you. But let's do something together. I'm just going to try to help you feel a little bit better. Okay. So I want you to imagine all of those things that are making you nervous right now and all those things you told me about that are making you anxious, and imagine all of that worry just going right down your arm and right into your fist, and just pull all of it into your fist. Anything that's bothering you in your heart or your mind or your body, just put it right there in your fist. You got it there, Julie?
I got it. There's a lot of it.
And now I just want you to open up that fist and let it all go. Just kind of shake it out and let some of that go, okay? The other thing, if you notice, which is really good about both of these two interventions, is they don't take a lot of time. So if you have someone with dementia that, you know, can't pay attention for a long period of time, they struggle with concentration, they get distracted, this is something you can do very quickly, really in less than a minute, and you'll kind of see them calm a little bit. So we wanted to give you a couple techniques that you don't need to be a psychologist to use with your residents, and that can be very, very effective to help manage those increased emotional stressors and feelings that they might experience. So with that, that is actually our brief presentation on managing emotional distress non-pharmacologically in our residents with dementia. Feel free to reach out. My email address is there, so you can always email me with more questions, and we're happy to be supportive of you during this time. So thank you very much from me, Dr. Gabrielle, and Breeze.